Hi everyone. Today we have the privilege of speaking with Dr. Priyanka, a truly inspiring individual who has excelled in one of the most competitive exams in the dental field, INICET. With the incredible dedication and hard work, she has secured an outstanding rank of 20 in the recent examination. Dr. Priyanka has not only demonstrated academic excellency, but also serves as a role model for aspiring dental professions. In this session, she will share her valuable insights, preparation, strategy, and the mindset required to succeed in INICT. Whether you're just starting your preparation or looking for tips to refine your approach, this conversation promises to be both motivating and informative. Welcome, Dr. Priyanka, and thank you for joining us today.
Thank you so much, ma'am, for uh, such a kind introduction.
Yeah. So, my first question to you is, can you introduce a bit about yourself and share your INICT rank and score?
Right. I'm Dr. Priyanka Ravindra Pande from GDC Mumbai. I'm from 2018 batch, and my hometown is Nagpur, Maharashtra. And my All India rank for INICT November 2024 is 20.
So, what inspired you to pursue a career in dentistry and specialize in MDS?
Okay, well, I always wanted a branch with patient interaction. I never wanted to write prescription. That is my personal choice. I was always interested in surgeries or procedures on the patient. So when I got into dentistry, I was very happy. I was never upset that I did not get MBBS. I was actually the next person to get into a government MBBS college, but I was very happy when I got GDC Mumbai. It was the top college, and I had great teachers, great environment, great clinical exposure, everything that I always wanted. So when I finished my dentistry after doing my UG with all sincerity and fun, I thought I should do my PG right away because I think that when you are studying, it's better to study in a flow rather than taking a break, doing clinics, to getting a job. I felt it's better for me to just keep studying and get into the PG entrance examination hustle. And that is what I did because I think that once you leave the Goddess Saraswati's hand and Lakshmi comes, then it is very difficult to go back to studies. So that was my point of preparing for PG examination right away.
So, how did you balance your internship with INICT preparation?
To be very honest, in my internship, I did not study at all. I just attended lectures. I had joined CDs. I attended the lectures. I wrote everything. But there was so much of workload at GDC Mumbai. There are so many patients. The OPD is so high. And I made sure that I get the clinical exposure. I made sure I shouldn't compromise on that end. And also, it is such a happening college that we have so many events, and I made sure I participate in all the events, and I went on trips with my friends because I knew I wouldn't get that time back. So I have no regrets, but surely if somebody can study along with internship, very great. It's a great thing, I feel.
Uh, So, what role did coaching centers or online platforms play in your preparation?
Okay, so without CDs, I cannot imagine my preparation, to be very honest, because Raisen sir is an excellent teacher, no doubt. But overall, the exposure that you get at CDs, because everybody has joined CDs, so all the competition is there. So I made sure that right after my internship got over on 31st of October 2023. So I gave INICT November 2023 just for experience. I had not prepared anything. My pulse was all nice, clean, no markings. I hadn't seen it. So I gave the aims just for the sake of experience. And the very next day, I got a train to Davangiri. My parents helped me set up the house and everything at Davangiri. My senior was there, Dr. Ashwini ma'am. She helped me so much. She received me. She helped me find a good place, and I got such a wonderful house there with such great uncle and auntie, they were so kind to me. They literally treated me like their granddaughter, and I had such good environment around them. And then my friend came in after completing her extensions. I did not have any extensions, so I went right away. And then she came in, and we started preparing mid-November 2023. So this is exactly 1 year has completed since I've started preparing. And then for my NEET examination of 2024, there was just 4 months of preparation. Plus, there was 15 days of break because the exam was going to get postponed. So I came home because I had gone right after my college, right? So I was a little homesick, and I couldn't come back right away because of some commitment at my place. So my 15 days were lost there, but I gave NEET. I studied a lot for those 4 months. I did not compromise. I did not think, okay, maybe next NEET I'll do it. No, nothing like that. But I got a rank of 1500 and I was very disappointed. Then I met Ryson sir and he told me in 4 months of preparation, if you can do this much, it is incredible. So you join the lectures right away. And he made sure that he kept an eye on us. He keeps an eye on everyone, not us specifically, but in general. So we started attending the lectures, and he said also focus on the May INICT. So in May INICT, I got a rank of 171. So that was good for me. I felt okay, if I'm studying, it's good. And then once I gave the May INICT, I again took a break of 2 weeks because I had to come to my college to collect my degree, and I had to go to the university to collect a medal that I had received for a subject. And then I came back to Davangere on 10th of June 2024 this year. And then I studied like crazy. That's the only word I can use. I studied like crazy.
Okay. So, can you share how you plan your daily, weekly, and monthly study targets?
Right. Okay. So I'm a morning person since always. So I used to wake up at 4:30, and after waking up at 4:30, so 4:30 to 7 o'clock, I used to study. Then after that, 7 to 7:30, I used to exercise because I cannot start my day without exercising, exercise and meditation. I used to do that because it is very important to have a calm mind before starting your day. Then I used to go for my breakfast at 8 o'clock, then come back. 8:30 to 1 o'clock, I used to study again. Then 1 to 1:20 lunch break. And then I used to just roam around in the house. Like I used to take a walk after having my lunch. And I used to solve the app questions, read book and stuff. That was 2 months before AIMS. For NEET, I was not doing anything. But then I used to look at the app, read book, SR papers, everything. Then 3 o'clock again, I used to study or sit on the table and study. And then till 7:30, I used to study. Then 7:30 to quarter to 8, dinner. Come back till 10:30, I used to study, and then used to doze off.
Okay. Okay. So, which topics or subjects did you find most challenging and how did you overcome them?
To be very honest, I never call any subject my favorite, and I never say that this I hate this subject because
Okay.
then it creates negativity in the mind. I
Mm.
think all the subjects are important, and I always think that every subject has something to teach, right?
Yeah.
So I feel ki, okay, maybe I don't know the subject right now, so let us study. But for the sake of question, I think physio and GM is something that you don't study that much, so you find it difficult, you find it a little vague. But I think just following the lectures and pulse is enough. You don't have to go beyond that for physio and GM. For other subjects, I did.
So, did you like read only one subject every day, or like the whole day you used to read only one subject, or did you used to change the in between subjects?
I cannot read a single subject all day. That is a very bad habit I have. I just cannot. I get bored. So I made sure I make my schedule a little interesting. I used to study pharmac. Mostly I used to follow the test series, so I don't have to have the headache of arranging my timetable. Just follow the test series and you're good to go.
So, what study materials, books, or online resources were most helpful for you?
I think the lectures and the pulse are the base. They are the foundation. Without them, you cannot start. Pulse, synopsis, lectures, and apart from that, I made sure I did the app, the BDS Next app. I did the pink papers, and that is it. Like every subject, I used to write it down. Okay, Pulse, so many chapters, then synopsis, then lectures, so many lectures, and pink papers, the number of pink papers that subject has, then app questions, the number of app questions that subject has, and then I used to just tick mark. Before the exam, I should finish all these things, and then only I'll sit for the exam. So I had to make sure that before the exam, before the weekly exam, I completed all these things. For the extra books, subject wise, I think I did whatever sir recommended. PhD, for PhD, I did Vivek Chen. For Pharmac, I did not touch Pulse. For Pharmac, I studied only from Sparshgupta and the classifications that sir taught. Then dentist for some subjects like ANAT, pedo, DM, endo, and I think I did Jitendra Sharan for ortho, and yeah, I think that's it. Yeah, I did Arvind Arora for micro. Right.
Okay. So, how did you approach revising the vast syllabus so effectively?
Right. To be very honest, that is one place where I went wrong. Just because I did not revise to my satisfaction, I was not confident for this INICT. I felt ki, okay, I'll give my best, but I lacked revision. So I have this one trick that the aspirants can follow, that when you're studying the subject, I
Mhm.
think you should write it down that what will you read 1 or 2 weeks before the exam. So if you write it down, you you just have that mental satisfaction ki, okay, I've touched this subject. That is one thing that is very important, that you have touched all the 20 subjects before your exam, before your final exam. So you can just write it down ki, okay, I think this point is volatile, so maybe I'll just look at this point before going for my exam. So for me the revision was not up to the mark. I did revise, but it was not up to the mark.
So, what was your strategy for practicing MCQs, mock test, and analyzing your performance?
So it so happens that if you solve the app or you have seen Pulse very well, so when you're giving the test series, you will see the question and you will just realize, oh, I've known this question. You won't read the options and you will just mark it out. So
Hmm.
that is something which is very wrong. I think even if you know the question, you should be in a habit of reading the entire thing, because in the final exam you cannot dare to just do click 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 just because you think you have seen this question before. So I think you should be in a habit of reading all the 200 or all the 240 questions when you're giving mock exams, and when you are reviewing it the next day when the result has come, make sure that you pay special attention on your negatives, or somewhere you went wrong, especially those questions where you knew the answer and you went wrong. For me, for some reason, I did not commit a lot of silly mistakes. That was one thing that I never did. Like, silly mistakes were really not my thing. It's like if I don't know, then I don't know. If I know, then I know. So that was one thing that where I did not face any difficulty, but many people do. So I think if you went wrong somewhere, it should stick in your head. It should be like, oh, how did I go wrong in this? Just you should bombard yourself for at least 2 days with those negatives. Ki, I shouldn't have gone wrong here. So in final exam also you won't go wrong.
Okay.
It's okay to commit mistakes. I don't think it is wrong to commit silly mistakes. It's fine. They reduce with revision, but make sure you tell yourself, ki, oh, make sure you revise, ki, why did I go wrong? I shouldn't have gone wrong. Something like that.
So, did you use any apps or tools for time management, flashcards, or notes?
Um, App, so only BDS next app. For time management, I felt ki my brain only tells me, ki, okay, now I cannot take any more information, just stop. So, so when my brain tells me that, I usually stop. I used to step outside my room, my hall, and my Davangiri hall, and I just used to look at the trees, just look at the squirrels, just let my mind, get a little calm, composed, and then I used to sit back to study. And in general, we have that drive to finish the portions. So your mind also knows that he has to push. He has to, keep pushing till you achieve that target. So the mind will support you if you have it in your head.
That, that's a very good thing. So, what was your mindset and strategy during the exam?
Right. For the exam, I was constantly telling myself, "Ki Priyanka, you have not revised up to the mark, but you have to give your 100%. You have studied so well because I was performing well even in the subject exams. I was in top 10. No, I never crossed 50, never crossed top 50. I was in top 10 or top 20 itself. So I never, I, I did not compromise when I was doing the subject wise thing. But during my final exam, I felt ki, okay, Priyanka, you haven't revised up to the mark, but you have to give your best because you have studied. So that was the only thing that was driving me. Ki just you have to focus on every question. You have to believe in yourself. You have to just think about the question. You have to try to arrive at the answer and just manage your time. Keep a watch on the timer as well. You shouldn't miss any question. That would be a big blunder. That was the only thing that was going on in my head.
That's nice. So, how did you tackle tough questions or manage time during the exam?
Okay. See, I feel if it is tough for me, it is tough for everyone. That is what I used to tell myself.
Okay.
To be very honest, the people around me, I could just constantly hear them click, 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 click. Like they were so fast. And I felt, oh my God, why am I taking so much time on this question? Man, why everybody is clicking so fast? These are not that simple questions that they can just, further go through everything. So that was going on in my head, but then I told myself, keep focus on your paper and just don't look anywhere else. So the tough questions, I think you should leave them. In the first go, you should solve all those questions which you know, and you have to keep a little time, a little extra time in the end to solve those very difficult questions. Don't leave 10, 20 questions in one section because the section is just for 50 questions, like 50 questions for aims. So I don't think you should leave more than 10, 20 questions. That is too much. I'm talking about the first go.
Yeah.
Overall, you should not leave more than three questions. Three questions is a lot in one section. So for tough questions, I felt like that only. You just think about what you know and just try to arrive at the answer. That is it.
Okay. So, what is the most common mistake the aspirants make while preparing, and how can it be avoided?
I think the most common mistake is being negative, thinking, doubting yourself, comparing, negative comparison. Comparison is fine, it is inevitable. You will think that your friend is doing well, you are not doing well. But why think like that? It's better you should think, okay, if my friend is studying, even I will study. Tell me if your friend is not studying, even you won't study. You will think, okay, let it be. I'll also enjoy like him or her. So that negative comparison should never be there. I think you should be a kind person before. You should help each other because already it is such a competitive environment. Everybody is depressed. Everybody has pressure from their families that they have to perform well. So I think you should help each other. You should have positive competition. You should think, okay, even he is studying well, even I will study well. And you should focus on your own progress and not the ranks. I think it is very important for you to complete the portions and give your best in every exam. No exam should be taken lightly. Every exam is important. You should be in a habit to actively think and arrive at the answer. And another mistake that people do while solving pulse for the first time is that I've seen that they try to solve it. In the sense, they read the question and they think that, okay, maybe A is the answer, B is the answer. I don't think that is the way. I think in your first reading, you're supposed to read it passively. You have to see the answer. You have to see the explanation. Next time when you will see it, then you are supposed to actively think, or you have to think, okay, I mean, I've seen this question. Maybe I can arrive at the answer. Because then the first reading will take a lot of time if you try to actively solve it. So that is what I used to keep in mind that I used to passively solve it. Okay, this is the question, this is the answer, because it's a learning phase. You're trying to learn, you're trying to learn the concept, you're trying to learn that particular chapter. So I don't think you should actively use your brain when you're reading it for the first time. You should passively read it, understand it, and then mark whatever is important and then solve it in your later reading.
So, how did you stay motivated throughout the preparation process?
Okay. My source of motivation, to be honest, were of course our teacher, he used to motivate us so much. My teacher from GDC Mumbai also used to motivate us. They used to solve our doubts. They were so readily available all the time. Like really, yeah, a small doubt, we used to message them and they used to reply. That was so kind of them. And my father supported me a lot. My mother also supported me in her own way, I can say. But yes, and my friends, they were really very supportive. They constantly told me, you can do it, just believe in yourself. And it is very normal to doubt yourself, to think, okay, I cannot do it. It's too difficult. It's very, very normal. But you constantly have to tell yourself that keep studying, keep swimming, as Dory says from Finding Nemo. Just keep swimming. And that's it.
So, what advice would you give to the future NEET MDS aspirants and also INICET aspirants?
Okay, I think one should focus on their own progress. They should take motivation from others, but they should listen and find their own path, not do something bizarre. Everybody is doing pulse. It is just that if you do it more sincerely, with more honesty, and if you give it time, it's not about intelligence. I gave one whole complete year and I cracked the exam. And I did not have any expectations that I will crack AIMS. My father used to say, "Are you're going to AIMS?" I'm like, "Oh, please, I'm not going to AIMS." So that was one thing. But you should believe in yourself. You should think, okay, I can do it. It should be one day at a time, one step at a time, one exam at a time. You should not think, okay, my God, there are 20 subjects, where to start, where to end, because then you will be burdened by the whole thing. For those who have just started preparing, maybe they will think, if I join some coaching institute, for example, if CDs, and everybody around me is answering, and I don't know the answer, then I will be so demotivated. I don't know why people think like that. People should think, okay, if all these people who are studying here for a few days or for a few months, if they can answer the question, even I can. That is why I'm here. So if you learn to take everything positively, if you learn, okay, maybe today I don't know it, but today I'll learn it, tomorrow I'll know it. I'll keep it in mind. So for those people, I'll say, please start. Don't be afraid. Just because somebody knows something, it's fine. 2, 3 months ago, even they did not know anything. So
Mm.
it's very much okay, and it's very much important to start your journey and be consistent, be disciplined, be sincere. You should study seriously, not but not sad. Don't be sad about it. Don't be like, oh, I'm so depressed, I don't know how to study so much. Don't be like that. Be enthusiastic. Just find a way of making it interesting. Just think, okay, maybe today I'll learn this concept and then I'll know it. Just try to enjoy your studies. I know it's very difficult. Even I used to cry so much, so it's very much fine to cry, it's very much fine to be sad, but try to elevate your mood after one point. And keep studying. Those who are doing okay, just try to push yourself harder. I think you shouldn't be content. Okay, ठीक है, I've got this rank, I'm fine now, I'm happy, I don't need to study that much. Never think like that. You should always think, yeah, I can do better, I can do better, I can do better, I can still give my best, I can still study some more, but not at the cost of your health, of course. Keep your health in mind, but just make sure that you keep pushing yourself. Everyone, beginners as well as advanced people who know everything, just believe in yourself, and that's it. Stay positive. I think it's very important.
That's a very beautiful advice and honest advice. Thank you. So, are there any myths about NEET MDS preparation that you would like to debunk?
Okay, I think people think that only people from government colleges or people who are very, very intelligent in their UG days can crack it. I don't think that's true at all. Maybe they have a upper hand, maybe. But I think anybody who starts their journey and completes it with all sincerity, all honesty, and with good discipline, I think anybody can crack it. So I think nobody should think like that, ki I did not study in my UG days. Now how can I study and crack AIMS or NEET? It's nothing like that. You just study whatever is there in front of you, and make a good timetable for revision. It is very important. Revision is the key. Just write it down. Revision. Write it down somewhere, because it is very difficult to revise. It is so boring. It's like ki, you already know it and your mind says, I know it. Why are you telling me this again? So tell your mind you don't know it, better study it again. So that is very important. Revision is very important.
So how many questions did you leave during your INICET exam?
I left 9 questions. I attempted 191. I could have attempted more now that I think about it. But the paper was such that I felt, okay, maybe I'll over attempt it. It's fine. 191 I attempted out of 200.
Wow. So did you feel like more questions came from clinical subjects or non-clinical subjects?
To be honest, this paper, there were a lot of, it was a mixed paper, a well-balanced paper, I would say. Some questions were, you could really arrive at the answers very easily. You had studied it before. And some questions were regarding embryology of some lung or what, and we had no idea about it. So there were very vague questions as well. So I felt ki overall it was a balanced paper, just like a competitive exam paper. And clinical subject questions were their basic subjects were there, medical repeats were there. Medical repeats in the sense the current paper I think they had just put in here also the medical aims, and here this in this apna BDS also they had put about which we had no idea. None of us had, so that is fine.
So generally there is a like a saying that the INICET exam comes from the previous year questions. So did you feel the paper consisted mostly old questions, or was it a question surrounding the previous year question?
When I gave the May examination, it was a totally different paper. I felt, what is this paper? I cannot understand a single question. That is what I felt while giving the exam. But still, I got a rank of 171, which was really surprising. I felt, how? I don't know what I did. But in this November INICT, I felt there were repeats. It was not like there were zero repeats. Some questions were little twisted and turned, but you could arrive at the answers. But since the trend is such that you have to study repeats for INICT, I think you should, because everybody is doing that. But that shouldn't be the sole content of your preparation. It is a part of your preparation. Main focus should be on concepts from pulse and lectures. And try to solve as many MCQs as possible. It is very important. Because if you read set of information passively or whatever, actively even, unless and until you solve a question on that information, you don't understand, okay, this point was important. So it is very important for you to solve MCQs. So MCQ revision is very important. Repeats is important for INICT, not for NEET, as far as I know. And I did Red Book. So Red Book consists of SR papers and medical repeats. So I had completed everything. I did not leave anything.
How did you approach the picture-based questions?
For picture-based questions, I made sure I had a good organized folder in my phone. Whenever I used to see any PBQs, I used to just search it on the Google and then keep it in the respective folders of DADH or NAT or OPAT. I made folders. And before the examination, the weekly examination, I made sure that I will go through that folder as well. And even in the app, there were some PBQs. So I think PBQs are good. Now it's interesting. So I think anybody can just go through them as a break also, I feel. So PBQs is something that should be very handy. You should understand what is given in the picture. Sometimes the same concept is given and a different picture is given. But just because you don't know the concept, you have just kind of marked up the previous picture, you are not able to understand, okay, this picture is that only. So try to understand the concept and then keep that picture in your head. Anyways, pictures stay in your head. They are easy to recollect even in
Yeah,
the
while
exam.
giving my NEET exam in the year 2022, I was like, oh my God, there's so many picture-based questions and I know this, but okay. And I was a bit confused, but hopefully I scored well. So yeah,
Of
that's why
course,
I asked
ma'am.
you how did you approach the picture-based questions? Nice. And
I just had a folder, nice, good, organized folder.
so we extend our heartfelt gratitude to Dr. Priyanka for taking the time to share her invaluable insights and strategies with us today. Your journey to securing rank 20 in INICET is truly inspiring, and your tips will undoubtedly guide many aspiring dentists towards achieving their dreams. Thank you for your candid responses, practical advice, and encouragement, which have made this session incredibly enriching. We wish you a continued success in all your future endeavors and hope to see you shine even brighter in your professional journey. Once again, thank you for being with us and for inspiring us to aim high and work hard. From Team Dentowesome.
Thank you so much, ma'am, for this opportunity. I'm really, really grateful to you. Today only I saw your message early in the morning, and I was so happy that you asked me to do this. I'm really grateful. And if any one of your friends or juniors, if they need any help, I'm always ready to help them out.
Great of you.
And I think, ma'am, you are always a better guide than anybody of us. You have so much experience. I have looked up to you. You have
Uh,
always done so well right from your UG days.